back again, everyone. My name, again, is Jacob Serfling, and I'm the Director of Building Decarbonization Policy and Projects. Thanks for anyone joining us again for our podcast series exploring some of the Midwest BDC's working groups. The Midwest Building Decarbonization Coalition is working to decarbonize the Midwest building sector by 2050. With our focus on the states of Indiana, Iowa, Illinois, Missouri, Wisconsin, Minnesota, Michigan, and Ohio. And as folks involved with the coalition know, much of our work takes place in our monthly working groups, organized by different topic areas, which are a great chance for folks to connect with other coalition members and engage with the work we have to advance our different priorities around building decarbonization. So joining me today, I have Emma Hines and Abby Novinska-Lois. Emma is a senior associate on the carbon-free buildings team at RMI, and Abby is the executive director of Healthy Climate Wisconsin. Some of you may know it by its former name, Wisconsin Health Professionals for Climate Action. Emma and Abby are both very involved with the health working group. Very involved is probably an undersell on Emma's role with that group. But that is really a space that helps identify and strategize around key policy opportunities that ensure healthy buildings for all in the Midwest. They've really had a lot of success as a space for local public health and community activists to connect with the latest policy recommendations and research about the health impacts of fossil fuel burning appliances in our homes and workplace. So welcome, Emma and Abby. And why don't you go ahead and introduce yourselves as well? We can start with Emma.
Sure. And thanks, Jacob and the whole Midwest BDC for having us both. This is really exciting to do this. So Jacob, that was a great introduction, but to give a little bit more color, my background is in climate and public health. I work for RMI, which is formerly Rocky Mountain Institute. We're a nonpartisan, nonprofit organization working to accelerate the clean energy transition. And like Jacob said, I work on our carbon-free buildings team in particular, meaning that all of our work is really geared toward moving away from fossil fuels in the building sector in particular, in favor of cleaner and greener energy sources. But to zoom in one more level past the carbon-free building programs, I actually focus on the health and air quality rationale for making that switch away from fossil fuels. And I'll talk a little bit more about my role with the Midwest BDC and the health working group in a second, and I'll pass to Abby.
Yeah, it's great to be with both of you, Emma and Jacob. Thank you so much for having us. I'm Abby with Healthy Climate Wisconsin. We're a group of over 1,000 physicians, nurses, healthcare, and other public health leaders from across the state of Wisconsin who came together because we were recognizing that we couldn't really help patients in communities just from exam rooms or offices. We had to go out and make systemic change because a lot of the parts of our life that are the building blocks of health, whether it's clean air, clean water, having a safe home, like we'll talk about today, happen outside of the exam room and are reasons that people come in. So like Emma quickly spoke about there, fossil fuels are a huge factor of illness that we see. So we know that fossil fuels cause things like preterm births, stillbirths, cognitive delay, heart attack, COPD, asthma, really a huge array of illnesses. And so when we see those things every day in our work, we know that big change like we make here through policy and other work on buildings is really where we can prevent that suffering from occurring.
Awesome. Well, thanks again, Emma and Abby, for joining us, and all of your engagement with the health working group in Midwest BDC over the years. Very much appreciated. You both touched on this a little bit in your introductions, but maybe just talk a little bit about how you ended up coming into Midwest BDC's orbit and how long that relationship's been in place.
We can jump in first.
Yeah, go ahead.
Yeah, so I have been with the Midwest BDC for almost 3.5 years now, which feels crazy to say that big number at this point in time.
Yeah.
That coincided with me starting my role at RMI at that same time point. One of my first tasks upon starting at RMI was to help build a network of advocates who are really fired up about this connection between building decarbonization and health that I think we'll talk a little bit more about in a moment here. But we, at the time, hadn't really engaged very deeply in the Midwest region. A lot had been happening on both coasts and some bigger cities interspersed in the middle of the country. But the Midwest BDC was just this natural landing spot for me to help build out this network. And at the time, the coalition was starting to build out their working group structure. So it was just a natural spot. So that was really what got me started here with the coalition and with the health working group in particular. And I can go ahead and talk a little bit more about our objectives if this is the right time too, or I could hold that.
Yeah, no, go ahead.
Sure. I think this is a good opportunity up front just to tell people what we're doing as a working group. So our three main objectives that we created as a group up front were to convene, so quite literally to bring together this group of cross-disciplinary advocates who are interested in this intersection between health and building decarbonization, but also to grow together. So what that looks like is building our skills as a group, but also our knowledge and understanding of this topic. And then the third objective is to act on that. So identify and actually act on policy opportunities that can advance our goals for decarbonized healthy housing. So a little plug for what we do up front.
Yeah, absolutely. Absolutely. Yeah. And I think, yeah, it's nice. It's so nice when those timelines kind of line up with what different groups are doing. I think it certainly was extremely helpful in getting this working group up and running, that that RMI was looking to invest in that type of work at the same time. So that's kind of the perspective from one of our larger coalition members of how they came to engage with this work. Abby, I'm curious, as more of a state level network, what that experience getting involved with Midwest BDC has looked like.
Yeah, that's a great question. I'm trying to remember the beginning now because it was honestly a while ago now. I think it was either end of 2021 or early 2022. And we have actually also been doing some other work within hospitals and clinics themselves because these are huge buildings. They use a lot of energy. Anyone who's gone to the hospital probably can recognize all the machines we're in and connected to all the time. So we were working on reducing waste and energy in those spaces. And one of our kind of nurses who is an expert in sustainability in hospitals was like, hey, there is this really cool coalition. I've been kind of starting to attend it as like Advocate Aurora, sustainability rep a little bit, but I feel like it actually, it's a fit for the buildings work, but also they're talking about like what we can do in our homes and communities too, to also make our buildings and healthier places. And so they were like, we really think that health professionals would be into this. We're always talking about how, so many of our patients just frankly don't have safe places to live and how that impacts their health. So that's kind of my initial intro. And so she's like, come to a meeting with me. And then I never left. We've been a member ever since.
Nice. Well, yeah, we're happy when we can kind of get our hooks in people like that a little bit. So, that's great. And we've kind of been dancing around it a little bit, but I think the whole point of this podcast series has been to try to expose some of this work and these topics that we've been exploring to folks that maybe haven't been attending some of those meetings on a regular basis. So it probably would do us some good to back up and it's obvious to us because we kind of marinated in it all day, every day, but what is the connection between health and equitable building decarbonization, as either of you see it? And whoever wants to jump on that first, go ahead.
Either way is fine. Just go ahead and start. But Abby, you're going to have to start on the next one to keep it even. I think there's a really powerful connection between health and building decarbonization that more and more folks are starting to recognize. When we think about efforts to improve public health and efforts to equitably decarbonize our building sector, I think at the heart of both of those is wanting to improve quality of life. So there's a lot of synergy between both of those efforts. And generally, I think there's this understanding that our health is really heavily shaped by the circumstances of the homes in which we live and the communities where our homes are located. So there's a couple of angles that I would point out to newbies on the building decarbonization topic of, what is the connection? So it's things like when we decarbonize our building sector, we're reducing our reliance on the fossil fuels that contribute to global climate change, but also the extreme weather events that we feel on a much more local level, which we know have negative health impacts. It also looks like cutting indoor air pollution right at the source when it comes to the appliances we're using in our homes. Ideally, this kind of work should also be improving efficiency such that residents are seeing positive changes to their utility bills, reductions in energy burden. And then obviously it's important that we prioritize this kind of building decarbonization work in the communities that have been historically disenfranchised and are, living in homes with a lower quality housing stock, as well as facing the brunt of environmental and health burdens. So there's just this number of ties between health efforts and building decarbonization, but would love to hear a little bit from Abby too on how the clinicians are seeing this connection as well.
Well, you spoke on a lot of it. So true when it comes to climate, even beyond kind of extreme weather. We see like the fossil fuels used in buildings are also contributing to disease outbreaks. We have some of the highest rates of Lyme disease and other tick-borne and mosquito-borne illnesses in the Midwest, and they're growing fast. We see other impacts, displacement. We see heat. I mean, you name it. We know the climate impacts our health. It's a very dire emergency. But at the same time, I think one thing we love about working on homes and buildings is we also see it as a huge opportunity. So Emma mentioned there's kind of these direct air pollutants that are being released in our homes right now. And it just frankly does not have to be that way. When we burn methane and gas in our homes, it releases other particles into our air and chemicals that are dangerous and can pass into our lungs and through our blood and brain barrier. And it has health impacts. So I think one of the most staggering pieces of information when I kind of talk to communities about this is living in a home with a gas stove, for example, is supposed to be about as hazardous for asthma as living with a secondhand smoker. And so as clinicians, we all talk about, and as health professionals, about how bad smoking is for health. These sorts of pollutants that are coming into our home every day are just as bad. So that's why it's so important for as health professionals for us to be talking about them. But also, when I mentioned it's an opportunity, it doesn't have to be that way. We have great appliances that can be cheaper to run. We have good incentives to get them right now that can lower bills, lower other costs, and make our homes just more comfortable. I think for many of us, we've probably lived in homes that aren't weatherized great. I know in Wisconsin, we have a lot of students, low-income folks, and people of color who are living in homes that you can't even go near the window in the winter because it's so uncomfortable. And that can be fixed by some of the fixes we're talking about here with decarbonization. And so also just that quality of life aspect.
Yeah, it's interesting you mentioned the asthma piece, Abby. A few weeks back, I was speaking to a group of school administrators and school facilities folks, just kind of doing a brief introduction to building decarb. And I talked about the climate impact and how that might be important to their students, a little bit of interest. Talked about the energy bill impact and operating costs, a little bit more interested. And then I started talking about asthma absenteeism and the connection there. And you should have seen these administrators' heads snap up and start paying way more attention to what I was talking about. So I think, one thing that I've appreciated with the health working group is that it can be a little bit more of a way in that gets a different group of people's attention than maybe some of the other things that we discuss when we're talking about building decarb. And you both touched on, a lot of different connections and a lot of emerging research that's out there with these health impacts. Some of it can get like a little bit like technical and in the weeds. Where do you find yourself, beginning when you're starting to share and have these conversations with a new audience of folks? And as promised, we'll start with Abby this time with that question.
Yeah, I mean, because my basis is in public health and I work primarily with clinician nursing audiences, as well as other healthcare workers, I tend to really start oftentimes with that stat on asthma, simply because so many Wisconsinites are struggling with asthma. And I think even beyond being health professionals, just as human beings, we all want our families to be able to live in a home that isn't actively hurting our health. We want our kids and everyone, our elderly, everyone in our home who's living with us to be okay and healthy. And so I think that's just something we can all agree on. And so being able to talk about some of those impacts, but also the opportunities, I think is a really big piece of this. I think sometimes, the news can be really heavy. Let's not deny all the horrific headlines we hear every day. So I think when people hear like there are opportunities available and it's not only going to be better for your health, it's going to be better for, these bills, and there are like solutions available now. I think that's a really hopeful message and is something that like I've especially found with audiences and like even with renters and stuff who oftentimes feel like they don't have a lot of agencies over their homes, feel like, yeah, this is a place where climate touches my life every single day. And it's something that, maybe I could say something to change or advocate for a program or policy that would give me some resources as a renter to do so. So I think a lot of times just kind of starting, or sometimes I start with a question, just like, what does your home mean to you? And do you, are you happy with your home right now? Or have you done any appliance changes lately? Or just kind of like questions like that, or paying attention to opportunities where people mention it themselves. You'd be surprised once you start listening how often people are like, oh my God, my furnace is broken. I just had to call someone. And then I'm like, opportunity, it's like that light bulb over your head. So also just listening in conversations can sometimes be the best thing, in asking questions about like what people want most from their homes, and then those health pieces. I'll pass to Emma.
I love that. I think very similarly on this question. I was going to say that health seems to be one of those like, near universal interests that folks have in common. And it really reaches across the aisle. And I think that we've had a lot of success in the working group and otherwise humanizing this topic by, like Abby said, thinking about individual households and what they want out of their homes. So a couple of scenarios that, I've talked through with folks on a relatively regular basis are, asthmatic families where someone in the family suffers from asthma. It's really important that they identify triggers in their home for that person's asthma symptoms, whether that's mold or a gas stove or otherwise. So that's a very easy in to talk about this without necessarily saying decarbonization. Similarly, we hear a lot that families with small kiddos are nervous when they are tall enough to reach all of the knobs on their stoves, and they may burn their hands on the top of a stovetop. And that's an opportunity to talk about the benefits of switching to an induction stovetop that we know remains much cooler to the touch and can be safer. There's also other things, like even in the Midwest, we know that extreme heat is becoming more and more common. So when folks talk about, I don't have AC and I'm starting to become more uncomfortably warm in the summer months, that's an opportunity to plug a heat pump that provides that packaged heating and cooling and can keep folks more comfortable and safe in their homes during extreme events. And then if power outages are the concern, we have talking points on how we can pair electric appliances with other measures like weatherization that Abby mentioned, as well as solar and storage to keep us riding out those storms from the safety of our home. So there's so many ways to pick up on this topic, and it really just depends on the interest of the folks that you're talking with. So I guarantee folks could find an in without necessarily having to bring in the building decarbonization phrase.
Absolutely. And I'll plug. I know we've been showing the link to learn more about the working group on screen as we go, but I think all of those different types of messages and things like that are things that we discuss frequently at those monthly meetings. So if you'd like to learn more, it's a great space to do that. I'm going to shift gears a little bit. Obviously, a big piece of the working group has been that education of ourselves and our members on all these different things that we've touched on. But we have taken on some other group projects, I guess we'll call them. And I'm just curious, as you kind of reflect back on the last couple of years, Emma and Abby, what you kind of think the wins have been for that working group as we've collaborated together. So either one of you that wants to jump on that with something that stands out for you.
Well, maybe I'll start so we can go chronologically, because I think I'm going to pick an older example and let Abby pick a more recent one. I think the first example that really solidified the value of having this kind of health working group was back in 2023. The federal regulatory agency, the Consumer Product Safety Commission, or CPSC for short, had released this formal request for information on the topic of gas stoves in air quality and health, and was seeking input from the general public about that topic. And we as a group decided this was a great opportunity to flex this muscle that we've been putting together like talking points on, and actually communicate our thoughts on it. So we had 90 days to coordinate this response to the 27 question response or request for information that was requested. And we had these talking points put together that were able to supply us with the basis of our response, which focused on what pollutants are produced by gas stoves, a little bit of conversation on whether ventilation is effective or not, and then what are the impacts on folks' health when they live with the gas stove. And based on our findings from the scientific literature, we ended up supporting CPSC in their investigation of various solutions that could help address gas stove pollution. So a long-winded way to say that I think this was a really big win, because the CPSC actually ended up receiving over 9,000 responses to this request for information, which, when you think about the magnitude of that response, it would be easy for any individual response to be buried. But one really exciting thing that our health working group did was we actually sought support from 33 other Midwestern organizations to amplify this voice from the Midwest that was very clearly in favor of protections for gas stoves, or for human health against gas stoves. So that was one very clear win, but I'm going to let Abby talk about a more recent one that we're still engaging on.
Absolutely.
Yeah, something we've done pretty recently, that is when I mentioned that there's a lot of opportunities right now and solutions available for individual households. This is one of the things I'm talking about. So under the Inflation Reduction Act, there are actually a whole bunch of home rebates available to families. And what those programs look like when the Inflation Reduction Act passed was going to be decided by each state energy office. And so that means that each state energy office was looking to the public and opening up public input sessions. Most of these have occurred kind of from January and are still occurring for some states. Ours was early in the year in Wisconsin, though. So in my brain, I'm thinking January. But we had to weigh in on what we wanted those programs to look like. So who would be prioritized with the money that states would get? What type of retrofits or what type of programs would they want to put the most money towards? How would people access it? What would the applications look like? So many questions were up to kind of public notice on what we want those programs to look like. And those questions were really important, because some of them are the difference between money being being put towards to like more gas in our homes. Like, do you get your gas furnace replaced by another gas furnace, or do we change to a heat pump and incentivize that in our programming, which we know will be better for health and better for our climate? So considering this is, a huge policy that was passed primarily for climate reasons, and climate damages our health, of course, as health professionals, we were 100% going for electrification appliances as part of that work. Personally, we also as a group wanted to see as many resources as possible for renters or lower income folks. We wanted the applications to be as accessible as possible. And as a working group, we all weighed in and we agreed on kind of 5 main points we all saw, as well as health tracking points that we were hoping that the agencies would actually follow across time so that they could actually report on their successes or where they were at on things like asthma, on cardiovascular cases, and on mental health cases. Because when you're thinking about your energy bill or your home isn't comfortable, it impacts your mental health and stress level. And so we put together all these talking points, and then each state has now been able to use them to help others in their state actually submit public comments that are health informed, that ask good questions. I know personally we used it to get about 10 health professionals to the public comment periods. And then we also did an organizational letter for organizations in Wisconsin that wanted to join us. And then we've kind of been able to provide guidance to other states, because Wisconsin was the first one in the Midwest, on like what some of our outreach looked like, and what maybe some ideas could be for them. And then in turn, they kind of can give us feedback back. And Wisconsin is now, I think, we were the very first in the country to release our homes rebate. So now we're seeing some of it in action and are hoping to continue sharing those lessons. And I think that's really the benefit of a lot of this like coalition work, is we can share what worked, what maybe didn't work with each other, and like get each other's ideas about what needs to be in a comment letter. How do you testify? And like all those little questions that are sitting on our minds can get answered by a group of folks who are so knowledgeable. And so, we all share the same values of trying to make these homes healthier.
Yeah. And I think we did see that have an impact in Wisconsin. If you look at the plan that Wisconsin filed, there is stuff in there about tracking impact on asthma sufferer households and trying to steer more of the rebates towards those households. That wasn't necessarily stuff that Wisconsin was going to be required to do. So really kudos to every person in Wisconsin who pushed for this to not just be a bill reduction, a rebate program, but also looking at some of those health things. It does look like it influenced what the final shape of that program was. And I'll just plug the talking points and other resources around the rebates program that Abby mentioned. You can still find those on our website at midwestdecarb.org/advocacy. We do still have some official public hearings coming up in Illinois, in Iowa in the near future. And I'd also say, even though those like officially required public hearings have passed for other states, it still is worthwhile to communicate with state energy offices about what's happening with those programs, especially if, maybe things go right over the next couple of weeks and we get another bite at the apple with some of those programs. There's no reason it couldn't be even better the second time around. So I know we're rapidly approaching the end of the time that you were kind enough to give us here this afternoon. So maybe we'll just do one last question. And I think, obviously the three of us on here are kind of representing the professionals end of the working group of folks who kind of work on all of these issues for a living. But we do have, I think, a pretty diverse group of members that show up to that group, both in terms of, professional roles and backgrounds and where they're located. Maybe as we wrap up, you can both kind of touch on what the benefit of being able to tap into that type of network has been for the two of you. Emma, do you want to go first?
Jump in. I think personally, as somebody who works at a nonprofit and spends a lot of time with other folks that work at nonprofits, one of the most enjoyable parts of being part of this coalition has been engaging really deeply with folks on the ground in communities across the Midwest. And as somebody who is not personally located in the Midwest, so a little bit of an imposter here, it's been really nice to get to understand firsthand what are some of the unique aspects of Midwesterners, like learning about the range of political ideologies, of demographics and socioeconomics, about climate zones represented in this part of the country, and so much more that really makes it a unique landscape for building decarbonization work. But at the heart of it all, I think health has been such a great message that resonates with folks. So glad that we were able to find each other in this and get to talk more about health with folks on the ground here in this region.
You're not an imposter. You're a welcomed guest, Emma.
So true. And I mean, everyone knows we're Midwest nice. So please come visit us. And so I think the only other thing I could add is like, not only I think the different perspectives and like how that just makes our advocacy and our resources so much better and richer, because we also, like, as someone who is kind of in this role thinking about this all the time, sometimes I forget what maybe I'm not communicating or what I'm missing, because we all have a different experience. And so it's so helpful to be able to hear those questions, and then we refine the talking points, or to hear those stories that we might have not recognized in our advocacy, so that we can write an extra piece of guidance for our policymakers and agencies. So there is definitely a role for everyone. You do not have to be a part of a practicing organization to really bring a lot to the health working group. Because I also want to emphasize that, like, the stories we share on how this impacts our health and our climate are also so incredibly powerful, and each one of us has one of those. So please know that everyone is welcome, and we'd be excited to have you join us.
I think that is a great message to close out on. So again, thank you so much, Emma and Abby, for joining us. Thank you to folks that are joining us live or maybe listening to the recording later. We hope you're interested in joining us at the working group in the near future. We'd be happy to add your voice to what we're doing. And there's going to be plenty more opportunities to get these different health impacts of fossil fuels in our homes addressed in the near future. So we need all hands on deck for sure. So with that, though, I think we'll wrap up. And thanks again, everyone, for joining us for this working group podcast series with Midwest BDC.
Thanks, Jacob.
Thanks for having us.